Good afternoon. Thank you for joining us this afternoon. I'm Marlon Visser, and I'm one of the senior health specialists with Jetter & Company. This webinar is scheduled for 30 minutes, so it won't take too much of your time out of your busy day. Before we get started, we have everyone muted, and at this time, you can type your questions in on the right. We'll address them at the end. I'd like to introduce Andy Larson, the Regional Sales Director with Allstate Health Solutions, to talk about the Medicare Supplement Multi-Discount Dental and Vision products. Go ahead, Andy, take it away.
Thanks, Arlen. I appreciate that, and appreciate all of you for taking time out of your day to join us and learn more about Allstate Health Solutions. As Arlen said, my name is Andy Larson. I'm a Field Vice President, Regional Sales Director for Allstate Health Solutions. Let's see here. Arlen, okay, so keep moving along there. And then, with Allstate Health Solutions, you may recognize us as National General. That's where we started. And if you're not familiar with Allstate Health Solutions, thinking we're a new client, obviously you've heard the Allstate brand, but we were recently, Allstate Health Solutions was born out of National General. Our roots go back 50 years through certain entities and whatnot, Assurant Health, National Health Insurance Company. So we're not new to the street. We're not new to the market. We're just we're bringing a Allstate brand that brings familiarity to you and your clients. No longer will you have to say who is National General. You bring peace of mind and confidence. That's what the brand does. And as your customers will know Allstate in all other different fashions, then it'll be there. Arlen, may I recommend that we switch to my screen, please? I think it might flow a little bit better. If you could, just give me the controls, and then I'll turn it back to you at the end. Is that possible? Perfect. Thank you. So have a little bit of a flow here to it. So in terms of the brand Allstate, you'll see it in many different shapes and forms. And from that standpoint, when you think about Medicare supplement in general, that brand is one of the key components to it. So I don't want to overstate it, but certainly might be important to you for a lot of reasons we'll get to in a minute. But with Allstate Health Solutions working with us, we are all things individual, not just a Medicare supplement carrier. We have a broad suite of individual products, solutions for all ages, solutions for all agents, no matter what line of business your focus is or what that cross-sell might be. Obviously, we're here today to talk about the senior market, but as part of your contract, you also have solutions available to you in the under 65 range as part of your contract as it pertains to short-term medical and under 65 short-term medical and supplemental. So working with Allstate Health Solutions, we go back, like I say, we go back many years in terms of the products that we offer and the teams that we have in place to support you. So we are not a new carrier, we just have a new brand, but that brand's gonna be more familiar to your clients and perhaps some of the other brands you offer just for other reasons. So truly are that Swiss Army knife. If you are interested in under 65 products, contact the team at Jetter, but we also have a team here to support you, and that's Sherry Blackwood, that's for our under 65 products. But turning the page to the meat and potatoes here, the senior market, and what we've done here that's pretty interesting. We've developed some innovation to a product that, for lack of better terms, is commoditized. The CMS regulates the Medicare supplement product. They all look the same. There may be different value adds that make one different over the other. And again, it comes down to your decision to recommend a carrier to your client. It might be that trusted brand, with Allstate being a brand that your clients may know and trust. Or it comes down to competitive rates, or maybe the process is simplified. How can you go through the process without having too many hiccups or having to jump through hoops? Obviously commissions are important, but also the service. But when you pick up the phone to troubleshoot, do you have someone on the other end? So over the course of this today, we're gonna check all those boxes here for you pretty much. And from there, after you leave today, hopefully you'll have a different look on Allstate Health Solutions, and you're willing to just give us that one shot to try out that process, to see the rates, and then ultimately be a part of a brand that's on the move here in the senior market. So with us, I talked about the brand a little bit. We have an A+ rated AM Best rating. That might be very important to a lot of you, especially if you're a financial advisor. That may be a requirement. But talked about the innovation, doing some things interesting and different. As we took on Medicare supplement, we've been, as National General, now Allstate, we've been in this space for about 5 years now. And when we first started off on this, we were plodding along. We had outside reinsurers, outside TPAs, outside actuaries, and underwriters. But when we became Allstate looked at the senior market and thought and expected that this would be the next big growth venture for the accident and health enterprise. And by thinking that way and doing things the way Allstate does, they allowed us to take on total control of the Medicare supplement product. So now we own all the risk. We have our own actuaries in-house. We hired on our own underwriters and own service people and developed our own e-application. But the biggest thing as part of that is our inside people now had more flexibility to create a product that might speak differently in the market. And that's in the form of our multi-discount Medicare supplement. We're going to get into this here, but the long and short of it, 25% off, up to 25% off in stackable discounts. With a process on an instant decision e-application, that 80% of your applications are going to be issued on the spot, and an instant an ID card can be available to your client either on the spot or within the hour. So those are, when you think about the differentiators, process, being able to get 80% of those clients issued on the spot and an ID card in their hand, that just lends more trust and credibility to what we're trying to build here as a brand with Allstate Health Solutions. So let's talk about the Medicare supplement and the discounts especially. So you say, okay, Andy, 25% discounts, that sounds great, but wait a minute, you're just going to lower your rates 25%? Well, what's that going to look like for your loss ratios? Well, that's a great question. And the loss ratios, as we look at it, we believe that these discounts will actually help our loss ratios because we're not lowering it for everybody. The discounts are stackable up to 25%, and they're geared towards certain elements where we believe that the discounts we offer actuarially have value as it pertains to claims and in a positive manner. But let's start here with what stays the same, and that's with our 7%, what we call not household, but roommate discount. We offer the 7% discount to those residing with somebody 50 years of age for at least 1 year. Maximum of 3 residents because we avoiding assisted living facility type of arrangements. But where we took a step further with the new discounts here on the roommate side is that we've added 3% to the discount to make it 10 when 2 people in the same residence apply for Allstate MedSup at the same time. So it goes from 7 to 10 when 2 people in the same residence apply with our MedSup at the same time. Now the key word here is apply. That dual applicant discount, if they're both underwritten cases, let's just say one does not pass medical underwriting, we're not going to take the 10% away from the other applicant that does pass through. So as long as they apply, we're still going to offer that the full 10% rather than the 7. So that's continuing on the roommate discount, anywhere from 7 to 10 on the discount for household. But where it gets interesting, and when you start to be able to get deeper in with your clients, if you were to ask your clients, do you have the ability to pay annually for your premium? And if they've never been asked that question, or if they've been a saver, they might say, maybe, yeah, I have the ability to pay annually. Well, if you do, Mr. or Miss Client, you have the ability to realize 10% by paying annually with Allstate Health Solutions. Now, that's going to be a significant discount. Number one, it's rooted in an element of financial underwriting. Actuarially, the data shows that those that have the ability to pay annually tend to have better claim outcomes. So therefore, we're looking at it from a standpoint of financial underwriting. Now, also too, when you factor in, when you look at like a platform such as CSG, in some markets, those margins between carriers may be razor thin. By doing nothing more than your client paying annually, that might leapfrog Allstate Health Solutions to either competitive or up to the top of the list just by doing that financial underwriting. Now you're going to find as you look at Allstate Health Solutions, we're pretty competitive where we have this concept in the markets that we're in. We'll show that in a minute, but it's going to put a cherry on top no matter what. When you factor in the annual paid discount, a huge 10% discount, we'll show you some examples here how that impacts the pricing. And lastly, the final discount that would be available to your client would be in the form of an activity tracker. So the activity tracker, like an Apple Watch, Fitbit, whatever that might be, whichever connects to one of our app-based services. If your client is willing to connect with Allstate Health Solutions, that's another 5% discount that your client can realize. And little secret here is that a lot of the smartphones already have these apps built in to track steps. And what we're looking at here is a element of behavioral underwriting. Those that tend to utilize step trackers or utilize it for fitness tend to have better claim outcomes as well. So there's no guarantees on any of these, or especially the activity tracker. But at the end of the day, we're willing to take that bet that says we're going to have a better block of business because we're attracting discounts that are meaningful in the realm of claim outcomes, and therefore be able to remain competitive over time. Now, if you were to say, well, how are things performing up to date? If you were to ask our actuaries, they would say that based upon the data that they have in the first 9 months of this concept being in the market, it's performing very well. So we're really excited about that feedback here as we're coming into our first full year of these discounts being in the market, and the success behind it is starting to show in the data. So that's the discounts. It can be anywhere from 5%, 7%, it could be 20%, it could be 17%. Really, the mix all depends on what your client's situation is. Maybe they're only have one person in the house that's applying, but they want to do annual discount, that's 17%. Or if they only have want to do that or able to do the activity tracker, that discount might be 5%. But all in all, if fully realized, that can be up to 25% savings for your client, and that's not only provides savings, but it's a differentiating story that you can tell that will allow you to get deeper into your clients, have more conversations, and provide more value to your clients that they're not seeing perhaps from other carriers. So that value propositions to your clients is always going to be a winner for you. More value you can provide, more cross-sell opportunities, more referral opportunities, retention, and ultimately revenue growth. But before we even get into the discount piece to it, we also have rating classes that are available to reward your healthier clients with a better rate, and that's through our preferred select rating. We've always had our standard and our preferred rating class, but with the preferred select, it's one additional criteria, or two additional criteria, a differentiator on the build chart between preferred and preferred select. Now, if you scour through this, you might see that, you know what, it doesn't really look that out of line to be a preferred select risk. And then the other question is, within the last 5 years, has medication been prescribed or recommended for depression? When we rolled this out, we expected about 70% of our clients to qualify for preferred select. We're running right about 60 to 65, so within the margin of error in terms of what we expected. So between preferred select, attracting that better risk, and then the discount profile, we believe we have a concept here that in the long term are going to help with loss ratios and keep increases very, very manageable for your clients. Therefore, you won't have to be searching year after year looking for a better rate. So concept, great. I might have some more questions. We'll get in touch with our Jetter company or you, Andy, after this to figure out a little more, get more detail. Where is it available? Is it available in the market that I'm marketing in? The states in green are states where the concept is live today. The states in yellow are states where we're going to see live for 6/1 effective dates, likely at the end of April. So you'll be able to quote it at the end of April for June 1st effective dates. So Pennsylvania, the Dakotas, Wyoming, Utah, and New Mexico, it's coming your way. The states in blue are either states where the states have not allowed the discounts to be approved based upon their rules around Medicare supplement plans and discounts. Some states might have wonky rules even around household discounts. Or there's states that have some sort of a guarantee issue rule like an anniversary or a birthday rule. So The roadmap here today for 2023, the green and yellow states will have multi-discount all by June 1st effective dates. We have launched new charters in some markets as well to reduce pricing just in general. And so that's where we're headed as a carrier with the scope of the footprint, the product, and provide more competitive rates than we've been able to offer when we first launched, and reach more markets and more sectors of the senior space, not just switcher business, but also T65 business as well. So just to give you an example of how this would work, these are just going to use a couple state examples, but you can correlate this to any state that you look at within the markets you happen to be playing in. So if you're to look at say the Plan G, if you look at that preferred select rate, this is in Iowa for 3/1 effective, $91.99. They add in that 7% household discount. Now we're down to 85. The dual household discount, add on another 3%, your 10% total, 82. Then now we go into the dual household discount, and now we're going to add annual pay. So now our total discount is up to 20%. Client pays $894 annually for that first year, but that averages out to about $74.51 per month. Add in another 5% on the activity tracker, and now we're down to $70.79 for a Plan G if you average it out, but it's going to be paid annually at $849. So I'm sure your mind is spinning here a little bit and saying $70 for a Plan G, that's phenomenal. Or you might be saying, well, okay, that's $90 down to an average of $70. We just saved that client $250 over the course of the year. Where could that $250 savings go toward to serve my clients? Maybe it's going to be other products and services that you offer within your agency. Maybe it's a dental plan with Allstate Health Solutions. Maybe it is savings to offset and counteract the inflation that your senior clients on a fixed income may be experiencing. There's many stories that you can tell, and as a trusted advisor, you can go down that path and choose a different path as the story unfolds for your client, and really tell the story not only for them, but in terms of the discounts, but also tell the story of how that savings can be repurposed, and again, provide more value to your clients. And the more value you can provide, you remain that trusted advisor for your client. Some examples of states where it might be community rated, or like the Minnesota, for example, where it's similar type, but they're more basic. Instead of A, F, G, and N, it's basic and riders, or basic plus and riders. So same deal here. You have your preferred annual pay tracker. Household discounts not available in Minnesota, so just kind of give an idea here. But in community rated states, you can almost save almost $400 off of just a preferred rate, just by implementing the discounts. That's huge savings, a huge story that you can tell your clients and offer a competitive rate rooted in actuarial data to help things stay sustainable over time. And home base for Art Jetter and Company, want to give a nod to the state of Nebraska just to give you some ideas here. Again, the story tells itself. So as you get into the platforms such as a CSG, that we'll talk about how that might look there here in a minute. Talk about value adds, so additional services that are available within the scope of the Medicare supplement. We always get asked, well, what else do you have? Do you have a gym membership? Well, first, we have the Amplifon hearing benefit, and that's going to provide discounts. That's built in. Discounts for hearing services, so free exams at Miracle Ear locations, but otherwise $75 for hearing exams at participating locations. The nice part about this, though, is that they are manufacturer agnostic when it comes to the actual hearing aid devices. So some services or hearing services might funnel the client into a steerage program where they go to one or two manufacturers. Amplifon doesn't get past that. But there's also some great follow-up warranties, deals on batteries, etc. So this is another selling point that you can include as part of the Allstate Health Solutions package. And also, as it pertains to gym, there's a benefit called Active and Fit. Active and Fit is a gym discount program, so they can choose up to 10,000 fitness centers, only $25 per month. So you have like Anytime Fitness, LA Fitness, Snap Fitness, most YMCAs. But at $25 per month, that's pretty inexpensive. I used to have used to is a keyword, used to have a membership at Anytime Fitness, and it was $45 a month. So $20 a month right there, saving off of a gym membership. No long-term contracts. They can switch gyms at any time. Some gyms might even be more than $45. Some might be in the range of $80. But that $25 a month gives them a flat rate and can provide them access to not only the centers, but many workout videos at home at no cost as well. So those are the value adds there for our Medicare supplement. So we talked about the brand, we talked about the innovation, we talked about, we showed you some rates, some competitive rates. You factor in what are some ways to earn money on top of commissions. We do have a bonus going on here for the month of March for the first quarter. So at the end of this month, the bonus period will run out. Typically, we launch new bonuses from quarter to quarter. But if you sell 5 Medicare supplement plans with Allstate Health Solutions in March, that gets you in the door for the bonus, and the bonus payout will be predicated upon the enrollment type. So if it's an underwritten or open enrollment, which we call T65 or turning 65, or if it's a birthday or anniversary rule, there's no limits. We'll pay you back the policy one. So some little extra incentive to point you on your direction here and earn extra cash getting off the ground with Allstate Health. So that's the Medicare supplement piece to this. Now we are more than just a Medicare supplement carrier. Our goal here is to become a senior market carrier, to have solutions for all agents. So as we continue to grow, you'll learn what we have in store. But what we have today here, we have a couple other products we'll just touch on briefly and then let you know what's coming down the pike. And then from there, hopefully we've gotten some questions into your brain in terms of what's next and where do we go. We'll scratch that as well and then let you on for your day. But as I mentioned, maybe you heard me say something about adding on a Allstate Health Solutions dental plan. We have a phenomenal senior dental product that has no waiting periods, available at age 55 plus. Again, no waiting periods, coverage day one for major services, basic services, dentures, and implants, up to 25%. And then the coverage doubles up in year 2. So call it our double up dental sometimes. But we have the ability to, on our level 3 plan, do 100% in basic coverage on year 2 and beyond. Again, dentures and implants are covered. And then we're going to talk here in a minute how you can get up to 20% in premium discounts on the DVH as well. Now, the V part, the vision, that is going to be a rider add-on. It's not included, but it's an add-on. So for the vision piece, that's through the Avisus network. So the Avisus network is going to be one of the strongest on the market when it comes to the retail side of things. But there's many more participating providers as well in this network. So with that, we'll talk about that here in a second more. But on the dental side of things, we have 3 different levels of coverage. Day 1 coverage, again, for basic services, 100% for preventive across the board. But as you go through, you'll see on basic services year 2 plus, 100% coverage year 2 plus on that level 3. Can't get any better than that in the market, so that's a pretty strong dental plan. Now, when it comes to the major services, dentures and implants, as you'll see here on level 1, they're not covered. Level 2, implants aren't covered, but dentures are. Level 3 covers dentures and implants. So it really all depends on your client's scenario and what they need. If they just want to have something for their cleanings, level 1 is a great option. They can find an affordable option under $20 a month, and that'll get them on their way with an affordable dental plan that's going to have a great network with the Aetna Open Choice Network. And our vision plan has 2 optional riders. You have a low plan and a high plan. More or less going to be based upon what the payout is and frequency on frames, contact lenses, and then frame lenses as well, and then copay for exams. So again, the vision is a rider add-on piece, cannot be sold standalone, again, through the Avisus network. And we've continued to grow our portfolio on the DVH side. So we have a vast portfolio. We'll have more to come as we continue to file in more states. But here's where you can find it today. And I mentioned dental, vision, hearing premium discounts. So we do have a preferred rate program for DVH. If your client has not had a filling, crown, root canal, denture, or implant in the last 12 months, that's a 10% discount they can get on their dental premium right off the bat, whether it's sold standalone or with a Medicare supplement with Allstate Health. Now, if you're in addition, though, if you are selling Allstate Health Solutions Medicare supplement and you bundle the DVH with the Med Sup, that's another 10% discount. So if both discounts are utilized or realized, that's 20% savings off of the dental premium for your client. So between any discounts applied on the Medicare supplement and the DVH, persistency discounts are being applied here on this front, and then the preferred rate is going to be more so the from a standpoint of those that have not had any of those four in the last 12 tend to have better claim outcomes as well. So some nice stories you can tell on the dental front also. And to round out the portfolio, we have a product called My Life Senior Wellness. It's a senior association plan, has some great great programs built in, such as telemedicine, podiatry discounts, LASIK, lab screening discounts, chiro discounts. Active and Fit is included on that as well. So if it's sold as a standalone, or maybe you work with some affinity groups, that this might be a good landing spot for them. The senior association package provides some nice benefits included, plus benefits that go above and beyond healthcare related. So tire replacement benefits, things like retail, restaurants, travel. So a nice little package there for geared towards seniors, though, which we also have something like this on the under 65 side as well. But the last product here on our portfolio that we have is what we call senior limited medical. There's 2 different levels or 5 benefit levels for this, but under the scope of max plans or base plans. Now, if you've ever had a client that missed their Medicare enrollment window, maybe they've retired late, they're on Part A but not Part B, and they have to sit out that little time period to get back on Part B to obtain a supplement. If they're shut out for that that time period, we talk to agents that say, well, I've kind of told them, we don't really have much for you. We can get you a hospital plan. Well, the senior limited medical plan does offer that nice little niche with a more of a souped up benefit. Offers first dollar coverage. Maybe if your client missed their window, maybe they don't have enough credits to qualify, recently emigrated to the United States, to provide supplement to what Part A won't cover. Hospital, surgical, doctor visits, lab x-ray, you name it, that's part of this. So if you have that client that missed their Medicare window, we have an option with our senior limited medical that can provide relief for those clients. Here's the footprint for that product. So if you have any questions here, take a quick glance at this. We can, if you're working in one of these markets, you might have a need for the senior indemnity or association plan. Let's talk further. And lastly, as we continue to grow as a senior carrier, we're going to be launching a final expense plan July of 23. It's going to be released in June for July quoting. So with the final expense, we're going to have graded level and graded options up to $50,000 face amount. It's going to be on the same platform as our Med Sup, so instant issue options are available. You think about final expense, if you're in that space, you hear about process being important. And then we have some available riders that are going to be, a couple of which are going to be built in, such as the grandfather rider, or grandchild rider, excuse me, and the accelerated death rider for terminal illness. Those are going to be included rather than add-ons, and our pricing models have shown to be pretty competitive, as well as our commission. So more will be coming out on the final expense as we continue to grow. And there's more product in the hopper as well. We don't want to be a plan carrier. We want to be a solutions carrier. All products for all ages, for all agents, as we continue to evolve as Allstate Health Solutions. Also like to introduce Chris Neek. He's on our sales team as well. He's our senior product sales manager, works hand in hand with Sherry. Sherry's on the under 65 side, but Chris is available to agents in addition to, as an extension of our Jetter's services as well, to help you at the point of sale troubleshooting for all your senior product needs. So keep Chris in mind if you have any questions. And lastly, as before we let you go here for the day, getting started. Okay, this sounds great, Andy. I think I like the direction where Allstate's headed. Everything looks sharp. I like the discounts, some of your value adds. I want to get involved with that final expense too when it comes down the pike. How do I get started? Well, first off, contact Art Jetter and Company. They'll get you contracted. One thing that we run into though with agents is, well, I see you guys in CSG, but I just don't understand it. Well, CSG is going to have the capabilities that they have just based upon how it's programmed. Our discounts are displayed based upon how CSG can display them in their programming. That said, if you see it in CSG, we recommend that you go to our platform and start enrolling there because it will walk you down the path in our platform. But for CSG purposes, when you enter in your information, make sure that you put the household discount as applied. The first thing you're going to want to do though is expand the record when you get to the results. And then within the record, underneath the rating class, it will tell you if it's a preferred or a preferred select rate, if it's a wearable or if it's a household, and it'll tell you what's included as part of that discount. Now the annual discount, there is a taskbar on the left-hand side that you'll have to check the box for annual rate, and that will provide you the annual rate as it pertains to the Allstate offering. Now, is it perfect in terms of how we wanted to display it? Absolutely not. But at the end of the day, CSG has been one of our top marketing tools over the last 6 months because they're showing Allstate Health Solutions at the top of the list, or if not close to the top of the list in all markets where we have these discounts. And if that means it opens up conversation, give Art Jetter and Company a call. They'll walk you through it, or get contracted with us and get to our site, and we'll walk you through it and let you know exactly what the percentage of that discount will be. And the instant decision underwriting will be there for you to utilize and have a simple process with Allstate. But when you do get contracted with Art Jetter and Company, you're going to get a welcome letter. It's going to require you to set up your back office, so make sure you do that. And then once you have your back office set up, this is your hub of all things individual with Allstate Health Solutions. So you'll have all sorts of guides and links to marketing materials, agent guides that has just little general tidbits of how to work with Allstate Health Solutions. There'll be alerts on your dashboard that tell you that you have policies that might have NSF or they're terminating or whatever it might be. And then you click on this quote senior button, and that will bring you to what we call EnrollNet Gen. We still call it EnrollNet Gen, just for lack of better terms. We haven't found a new name for it yet. But again, all those different things we talked about, the instant decision underwriting, the ID card right at the tip of your fingertips. You can upload supporting documentation that you think an underwriter might want to know, or proof of prior coverage. You can do multi-product enrollment with the DVH. Again, remember those discounts. And then we have simplified signature options for no matter what level of technology inclination your client might have. E-signature, voice signature, and we have a nice feature called security question, which can allow your client to sign with mother's maiden name. So we really make that process simplified for you. And from that standpoint, the hub of the agent back office is where you can go and you can manage your business and find clients, and you'll be able to see billing history, download temporary ID cards, know when the next bill is coming due, and all the information that you need to support your client with their business. They'll get their own client portal as well through it's called My Allstate Health, and once implemented, smooth sailing from there. And then our teams are here to support you and troubleshoot should troubles arise. So to wrap up here, if you want more information, we have access to a public site that has brochures and marketing material. If you go to allstatehealth.com under agents and brokers, go to marketing materials, but you'll also find provider search buttons there as well. So for dental plans with the Aetna dental administrators, and then all sorts of under and over 65 marketing materials, brochures, flyers, Medicare supplement policy or application packets as well. And then we also have a YouTube channel that can bring you more of a 5,000-foot view of everything of the products that we offer at Allstate Health Solutions. I highly encourage you to bookmark both of these. They're great training tools for you and any of your staff as well. And lastly, before I give it back to Arlen, I want to let you know about an incentive that we have for 2023. We have recently launched an agent incentive to Cabo. So February, March, around this time next year, we're going to bring our top 50 producers who write $600,000 or more in production to Cabo. It's truly a top producers conference, and it's for under and over 65 sales. So the product mix can be any of the above, but if you do sell Medicare supplement or are under 65 supplemental products, those products will be weighted heavier in terms of the qualifiers. So every dollar of premium that comes in for Medicare sup, that's $2 of qualifying premium for the trip. Now, this has already started, so if you have written any business with a 12/15 or later effective date of 2022, so maybe you wrote some business for 12/15 or 1/1, those policies are already in the door toward qualifying, and we go all the way through 2023 and end when under 65 open enrollment ends on January 15th of 2024. We'll tally up the results and get the invites out soon thereafter. And hopefully you can join us in Cabo as a top producer with Allstate Health Solutions. I'm going to turn that back to Arlen now, and want to say thank you on behalf of our team for allowing you to jump into your offices today and spread the word on Allstate Health Solutions. We're here to assist you and help as an extension of our Jeter & Company. So please be sure to let us know if you have any additional questions after today. Hopefully you got out of this what you're looking for, and you're excited to sell Allstate Health Solutions. Back to you, Arlen.
Thanks, Andy. A couple of questions that came up was, do you have access to the under age 65 for the life, short-term medical, those type of questions?
Yep. With that, it's as I mentioned at the beginning when we showed the product mix, but with regard to the under 65 products and the senior products, those should be all-encompassing under the same contract. The only way it's not all-encompassing is if whoever sent you a contracting link deliberately took products off, and I don't believe that's the MO at our Jeter & Company. So certainly you will have access to the full suite of products with Allstate Health Solutions.
Okay, great. Doug, I'll get back to you regarding Nevada on the commission. Joanne is asking about the activity tracker discount. I guess you can find out more about that online or after you get contracted with our Jeter & Company regarding the tracker discount. So I can get that taken care of. And then enrollment is done. The last question was enrollment can be done either electronically or by paper. Sooner or later, the paper enrollments are going to be going away, but I think that's everything, Andy.
Yep. Yeah. So enrollment can be done either way. Now we prefer, just for sake of ease and for sake of less chance for error, that electronic is done. Just it's a better experience all around. But we certainly understand that you guys have a certain way of doing business sometimes, and also clients have a certain way of wanting to do things as well. So just know that those options are available, but certainly our e-app was designed to be simplified for all layers of technological inclination. So
sure. And then I don't see any other questions. And if you would like to get appointed with Allstate, like Andy had said, please give us a call here at 800-228-0008. Ask for a senior health specialist, or you can email us at seniorhealth@jetter.com. And I appreciate your time on this webinar, and have a great day. Thanks, Andy.
thank you. Have a great day, everyone.